Assalamu alaikum. The article for this week is titled as Vital Root Resection with Radicular Retrograde Partial Pulpotomy Infarction Involved Maxillary Molars in Patients with Periodontitis. Technique description and case series considering clinical and economic aspects. Done by Antonio and others. They are from a group from Germany. From endodontic department and periodontics department. This article published in International Endodontic Journal in 2024. This case series provide us a new approach which can preserve tooth structure and reduces treatment time and cost in line with the principle of minimal invasiveness compared with conventional techniques. The root resection of a vital tooth is performed without prior root endodontic treatment in order to preserve the vitality of the tooth, and the subsequent pulp wound must be adequately treated. All we know that periodontally compromised multi-rooted teeth, especially maxillary tooth, showed an increased risk of tooth loss compared to single-rooted teeth. And the reason behind that the more complex anatomy and in case of soft and hard tissue defects with furcation exposed to the oral cavity. So the aim of this case series is primarily to present the concept of vital root resection with a one-stage radicular retrograde partial pulpotomy in furcation involved maxillary molars in patients with periodontitis, highlighting clinical and economic aspects. In addition to that, the approach is compared with conventional root amputation preceded by endodontic treatment, and also with vital root resection preceded by deep coronal pulpotomy. A total of 7 maxillary molars in 5 patients underwent one-stage vital root resection with retrograde partial pulpotomy in furcation involved maxillary molars. Strict case selection has been performed, which is indication was where persistent probing pocket depth greater than 6 millimeter and furcations greater than class 2 at re-evaluation 3 to 6 months after non-surgical periodontal therapy of stage 3 or 4 periodontitis. Negative percussion and positive thermal sensitivity testing by cold test of all 3 root sides individually, which is mesobuccal, distobuccal, or palatal, that in tooth to be treated. Tooth-related contraindications for this procedure were endodontic symptoms or radiographic periapical radiolucency and periapical radiograph with indications of that there is apical endodontic lesion or endoperiodontal lesion, as well as any signs of external inflammatory resorption defects of the root. For the surgical procedure, a Kirkland flap was raised around the tooth up to the bone crest without vertical incisions. The bony defects were degranulated and the root surface were instrumented with the curettes and sonic tips. The root least covered with bone was resected using a diamond pair immediately above the incipient furcation. Then the pulp wound was widened to a depth approximately 2 millimeter with a burr until proper bleeding was detected and immediately irrigated with saline. Once the bleeding is controlled, the pulp wound was covered with MTA. Then the pulpotomy site was then covered with resin restoration. After that, the flap was repositioned and sutured. Patients were instructed not to clean the surgical site mechanically, but to rinse their mouths daily with chlorhexidine. Patients were advised to attend regular periodontal care, and the frequency was based on the periodontitis grade. All the patient has grade C, so the follow-up was every 4 months up to 31 months. For the result, all teeth were in situ at an average of 26 months post-operatively and were clinically and radiographically stable. The mean pocket probing depth on the 7 treated molars was 4 millimeter preoperatively, and it's reduced to 2.5 millimeter at the last follow-up. Also, clinical attachment loss and bleeding on probing was reduced. All periodontal parameters improved over time compared to the follow-up. The teeth showed no mobility over time, and furcation involvement also was reduced. All teeth react negatively to percussion and positively to thermal test, and all patients were satisfied with the treatment outcome, and they reported no symptoms. This is regarding the clinical outcome. For the cost and time calculation, the lowest cost and the treatment time could be assumed for vital root resection with the retrograde partial pulpotomy, and compared to conventional root amputation, it was a reduction of approximately 70% in cost and 60% in treatment time was predicted. As a conclusion, in this case series study, this technique, vital root resection with radicular retrograde partial pulpotomy and furcation involved maxillary molars, was able to demonstrate stable periodontal and endodontic clinical and radiographic findings, but with carefully case selection. And thank you.